Hello everyone, welcome. Today I am offering an all-inclusive feeding video. This video will cover topics such as what I like to call the feeding swaddle technique. We'll go through step-by-step how to achieve this. We will also cover handling and positioning your infant during feeding to improve your infant's sensory organization. We will also go over safe use of your bottle system during feeding to decrease the risk of uncoordinated breathing or aspiration. And then finally, an overview of the Dr. Brown's Options Anti-colic bottle system. This video will be divided into sections, so if you are looking for more information in one particular section, you can skip right to that. Thanks for joining, and let's get right to it. So let's first cover the feeding swaddle. This swaddle is used within the neonatal ICU by the therapy team and nurses. It positions the infant in a certain way to give them a good amount of containment. This makes the baby feel very safe and secure when they know where all of their body parts are. When they feel contained, they're more able to focus on tasks such as feeding. Feeding is a very big task. So this swaddle involves their hands outside of the swaddle. We actually tuck in their elbows and have their hands close to their chin or mouth to encourage the sort of neurodevelopment that they are bringing their hands up to their mouths while they are feeding. We want to go ahead and encourage these pathways for regular motor and sensory development. Plus, with their hands here, you may start to see them holding their bottle or holding their pacifier. This is getting all of their fine motor skills involved, and it's just going to really encourage the right developmental milestones to be created. So next we're going to go through the how to create this swaddle. We lay the blanket out in a diamond position with one corner folded down to the middle. Our baby is positioned in the middle of that folded down corner, with the top of the blanket hitting just below the earlobes and above the shoulders. Starting from the baby's left side, we position the arm like it's holding a lollipop. Then we cascade the blanket over the shoulder, catching the elbow, and then turn the baby on its side to tuck that blanket in nice and snug. Now we bring the legs into a good tuck, and we support it with the swaddle by bringing the blanket up, tucking it in the same spot as the previous layer, roll it in, nice snug tuck. Now we bring the other side of the blanket over that shoulder. Then we also want to catch the other elbow with that blanket to give it an even more secure tuck. Then roll the baby, tuck the blanket right under the back, and if you can fit it, under the side of the baby. Now we're nice and snug. Okay, so before we transition the baby to our laps, let's go over our chosen bottle system. So I have with me the Dr. Brown's Options Anti-colic bottle. I have the narrow frame and narrow nipple. So what I love about this bottle is that it has an internal venting system, seen here. It has openings for air to be passed through and into the bottle so that there's no added pressure within the bottle as your baby is sucking. While we are feeding, it is very important when we tip the bottle, we make sure that there is a pocket of air within the nipple here. If there is no pocket of air and our nipple is completely full, that vent system is not working. So we need to make sure that air can get to that green vent to be pushed through the bottle so that there's no backup of pressure. So while you are feeding, you always want to maintain at least a little bit of airspace for that vent to properly work. So I have baby securely in my arms. My bottle and birth cloth are next to me. I'm going to position baby in an elevated left side lying position. The reason why we swaddled baby starting on her left side is that we ended with the swaddle open on this side, and I can then position baby so that that swaddle is now secure here. So I'm going to tuck up baby's hips and place it very close into my abdomen, which I am sustaining a good pressure. This allows for more containment and feelings of safe and security for the baby when they know where all their body parts are. I'm also going to hold baby with one hand, with my whole hand grasping shoulders. If the baby's too big, then maybe a little more support on the lower side. And then I'm going to make sure that baby's hands are correctly positioned at the mouth. I can kind of adjust the swaddle if need to give that good support, because we're going to maintain this for a good amount of time. We want to make sure that everything's set up correctly when we begin. So in order to achieve an elevated left side lying position, I like to cross my legs and then position baby on my upper leg. The reason why we are in a side lying position is so that if there is any spillage of the milk, it comes out of the mouth this way instead of back at the back of the throat where the baby may not be able to maintain it. So our baby's head is a bit higher than their pelvis to help with digestion. If crossing the legs to achieve the elevated side lying position is a bit too uncomfortable, you can certainly use other positioning aids like a pillow, boppy, or a blanket roll underneath to support your baby's elevation. Something else to check while your baby's in your lap is that baby's alignment. So there are certain landmarks that I want you to keep in mind when we're feeding. The first is making sure that the baby's ears, shoulders, and hips are all in a straight line, like this. The other thing is I want us to make sure that the chin and head is in line, in the midline of their neck. I also want us to make sure that our baby's not crunching down when they are feeding, because this can cause a crunched airway. And then we also want to make sure that they're not extending their neck. So if you look at the ceiling and try to swallow, you can see it's very, very hard to do. So just keep these things in mind when you're feeding your baby. In this side lying position, I have good visualization of the baby's face. If she were to give any kind of stress cues, I can also see her breathing. I can see how she's managing her hand. Okay, so to start my feed, my baby's in position and I have my birth cloth and my bottle right beside me. So I like to tuck my birth cloth under the baby with my left hand just so I can hold it while I hold her. So I shouldn't really need my birth cloth. It's only there for emergency, but it's good to keep in mind that if our baby is spilling onto the birth cloth, that's usually a sign that we need to pace more or transition back to a slower flow nipple because we're not able to manage all of the volume in the mouth. So when I take the bottle, I'm going to kind of hold it like a pencil and use the palm of my hand to capture the baby's arms and then offer to her just like this. I'm going to just briefly touch the bottle to baby's lips. I may try some stroking, soft, even, and gentle strokes on each side of the mouth. This is what's going to stimulate the rooting reflex. If we think of a baby breastfeeding, they may be moving their face along the mother's nipple. We're kind of simulating that same movement to stimulate that reflex. If the rooting reflex is engaged, they will drop their jaw, lower their tongue, and seal their lips around the nipple. Once the baby's opened and accepted the nipple, I'm not going to fill it all the way. Instead, I'm going to wait until the baby engages in an active suck, and then I will tilt the bottle, leaving that airspace in there and making sure that the baby gets good amount of milk without being too overwhelming. Throughout the feed, I'm keeping in mind that the infant is driving the feed. I always want to prioritize quality over quantity and make sure that this is a stress-free, positive experience for them. The way that I do that is I start to watch the baby and keep watching throughout the feed for signs or symptoms of stress. Signs of stress can be very obvious, and they can also be very subtle. Some obvious signs of stress might include crying or grunting, coughing, choking, breathing really, really fast. But some more subtle signs may include poking their tongue out or biting down on the nipple. These are both signs that they want to stop the flow of milk. More subtle signs may also include facial grimacing, where they're scrunching up their face. They may yawn. They may get the hiccups. They may kind of splay their fingers open. This is a very clear, expressive sign that they need a break. They may extend their arms. They may extend their legs. They may pull away from the bottle. Once you start to consistently feed your baby, you will start to kind of notice a pattern of signs or symptoms and be able to tell that your baby needs a break. So if I'm feeding and I start to notice some signs and symptoms of stress with my baby, I'm going to allow them a break. I may take out the nipple from their mouth and maybe place it on the corner of their mouth here. This is a signal to them that we are still feeding, but we're going to give them a break and let them regulate themselves. When I'm pacing a baby, I may give them a number of sucks with the nipple semi-full, and then I may tilt the nipple until it empties to cue them to breathe instead of sucking liquid. If the nipple is tilted and they're still attempting to suck, then I'm going to take the nipple out completely, place on the corner of their mouth, and let them breathe air. So one more time for hand placement. My hands are fully grasping the infant's shoulders here. My fingers are wrapped around the upper arm when I'm placed on my knee. I'm not giving any type of cheek support with my finger because I want to encourage the infant to use their muscles in their mouths and cheeks on their own to drink the liquid. So I will leave my fingers down here. So knowing my baby's risk for respiratory breath incoordination or even aspiration, I'm going to manage my bottle very carefully to make sure that I am giving them the appropriate amount of liquid without being too overwhelming, and watching for any and all signs of stress, any signs of incoordination, cues, things that I need to look out for to make sure my baby is having a safe and positive feeding experience. A good rule of thumb for me is to allow a burp break about halfway through the feed and at the very end of the feed. So how I like to burp is to sit up on my lap. I capture the arms or hands in the palm of my hand, and then I place my finger and thumb right under that baby's cheekbones. So while doing this, I'm maintaining an open, extended airway for them to breathe, because some of our babies may lack their head control and they may go into this number. Now, if our baby is doing this kind of crunches their airway, so they may not be able to breathe as well. So we want to ensure our baby is an open and extended airway. And back here, I'm going to lean the baby forward over my hand, and then using my palm, I'm going to just give some nice pats, firm but gentle. I may also do a little massage up the baby's back while maintaining that airway, providing some positive pressure. When our baby is older and has better head control, it's totally appropriate to transition to the shoulder and burp this way. It's when the babies are a little younger and have less head control whenever they're upright that they may need more support at the chin to make sure that their airway is completely open. Now, if your baby is experiencing any extraneous circumstances or comorbidities that require a more diligent or different feeding routine, it's very important to keep in mind your therapist's or doctor's specific recommendations. Thank you for taking the time to learn a bit more about your baby's experience being a baby. We'll see you next time. Bye.